Okay, so it was called SEER training: survival, escape, resistance, evasion, combatives. Where you're in the military, you're a pilot. They basically beat you and show you how to handle torture. The issue is that you have a connective tissue disorder. You have elastic skin. You can take your skin and pull it. You have this elasticity, and when you got injured, you really got injured. You just did not. You never bounced back. So I'll just show what we found. Now I can't even do it justice because the connective tissue is compromised the way it is. We're seeing dilated, or actually they're called aneurysms. We can see one here, and you might have them elsewhere that you need to have that whole workup. I know they've already looked for aneurysms before, but still there's an elasticity there that's in play that is, well, it's difficult to define. Okay, so I'm just going to show what we found on the imaging. Good news is we were able to get some response, get you to feel a little bit better. The visual snow, oh yeah, we didn't get into all the symptoms. The visual snow, the passing out, feeling like your own neck is strangling you, migraines, lightheaded, sensitive to sound, pulsatile, speech slurring speech, feeling like a heart attack that actually goes up into your neck. And actually, you've gone to over 40 doctors, a lot of symptoms. We're just going to show what we found, which is not comprehensive, but it's informative. Okay, so yeah, we you can see it where maybe the heavy rucksack, and you've pulled 7 Gs with a 25-pound, making your head weigh about 25 pounds with a helmet on it. So it's like almost 200 pounds. So you've done a lot to this. And I think some of the arteries have, well, it's just a connective tissue thing. But here's how, and it's like you were pledged. It's like you were pledging a fraternity where only it's military, and they were pretty aggressive with you. And I think that you really did kind of cave in here. So it looks like you kind of caved in from the front. The first ribs here aren't even attached anymore. They're floating around. We even 3D printed it, and I had to put a bar here because they would come off in two different pieces. So basically, your whole thoracic inlet is not attached. It's completely freely movable. Now, you can see the spaces in there. Now, I believe the connective tissue is still there, and that it would respond to injectables, Prolo or stem cells or whatever they're going to do. But we need somebody to try to tighten these up. There is no surgical procedure for it just yet, but just all of this moving around. And one of the things that you seem to, of all the structures that you point at, you do point to this spatulated transverse process, and there's a muscle that attaches from there to the first rib. And I think we're catching it before the muscle actually starts calcifying. There's lots of parts that hurt on you. So here's, I think, one of the muscles. It's this one right here. This muscle attaches to the first rib, which is free floating and not attached anymore. And that's called the levator brevis costrum. And it's pulling this transverse process and making it larger and spatulated. And we see that elsewhere, and when people have an atlas that gets larger on one side. So here's the thing, it looks like you've kind of collapsed to the right and forward. Come around here. And because you have this binding, this tortuous cervical thoracic junction, you can see how your whole neck kind of goes off to at an angle. I mean, everybody's eyes are going to be level to the horizon. So no matter how crooked you are, you're going to make your head level. And in your attempt to make your head level here, we can see what you've been doing here. So this part of the atlas has gotten taller on the side. It's under a load. You can see how this is part of the skull that's actually sliding out. And we did have we spent quite a bit of time figuring out exactly how to uncorkscrew you. So you're twisted like a corkscrew, and the forces have gone through you have been pretty significant. Now, I screenshotted a bunch of stuff here to help us tell a story. And the imaging can only get you so far. The physical exam helped us to understand exactly how this house of cards wants to be reassembled. What's responding, distortions within the distortion, that kind of thing. So we did find that you do have pressure in your head, and you were interested in hypertension, and yes, we have a jugular vein that's pulled like taffy. The jaw is a little loose, so the soft tissues look like they're kind of compressing there. Again, we recommend you to sleep with something holding your jaw forward, so this doesn't compress. Yeah, we saw some extra calcification as you're under a load, abnormal, unequal joint loading, and you are pretty hypermobile. The doctors do want to fuse you, but I think you'll get at least 80% better without getting fusion and just doing the biologics where they do prolo and they tighten all this stuff. So yeah, we did document how much it moves in through here, or how much space you have in there, and they're supposed to be touching. Oh, and we didn't even really talk about, so yeah, you're going to be you are stuck in a sympathetic state quite often, and the stellate ganglions actually, depending on the textbook that you're looking at, some textbooks have the stellate ganglion in front, some of them have it down here and below it. So either way, you could be hitting a stellate ganglion on both sides and driving that sympathetic fight or flight thing that you feel. Yeah, so they do stellate ganglion blocks for that. But by the way, tightening this super loose, and of course the sequela from this is that scaling's attached to this, and they're not going to be able to modulate correctly, so you're going to have a bobblehead. And if the muscles aren't modulating correctly and you're not able to have the correct tone, you're going to be leaning on your ligaments all the more, and they're going to get looser and looser. This is a line we looked from the bottom of your skull. We care about getting that atlas right. Yes, you've got a dominant vertebral artery on one side. That matters when it comes to getting you an adjustment. So this beautiful imaging we have, my gosh, my mentor, Dr. Roy W. Sweat, and before that we had John Grosdick, and before that we had B.J. Palmer. Those guys dreamed about being able to see what we can see today. We stand on the shoulders of giants, and they're helping us to really, oh my gosh, to understand this stuff. If they could see what we'd see, it's just amazing to be able to see this. So what did we do today? So we opened up the right jugular. We came in from the front on the right side to undo this rotation. We did not do a traditional vector that you would think from X-ray. We'll show you what X-ray showed. We'll show you what the slices of MRI and slices of CT would have indicated, which would have been better than X-ray for this view. But anyway, so after we adjusted this atlas, you got calmer, more peaceful. You got a little taller. Actually, you can tell me later what the symptoms you had. So here's the thing. When you turn your head to the left, there's a lot of binding in through here. This is what left head rotation looks like. You kind of zigzag quite tight. And then with right head rotation, you almost straighten up. So you're not talking about the top, but the cervical thoracic junction straightens right up with right head rotation. We've got documentation that you're not really good at turning to the left or turn to the right. All that combative training where they try to pull your head off it, and all that aggressive torturing you so that you can handle torture. I mean, all the hitting you in the head and all that stuff. Again, we looked. So here we did left head rotation and right head rotation, showing how these first ribs are just loose as a goose and opening and closing. And again, that's going to play out. So these muscles of the neck, one of your chief symptoms is that you feel like your own neck is strangling you. I would think that these muscles in your neck, and we show both sides, your muscles in your neck are not modulating, they're tight. Oh, when we have you lie down, there's a ratcheting or a tremor that occurs because when you're trying to stabilize your head as you go from lying down to upright. It was good that when you jut your jaw forward, when you go from lying down to upright, it does foster a little more stability, and you didn't get that crazy, like everything goes like a white sheet. That didn't happen. So we're going to have you do that for a while. Send you to somebody to tighten all this stuff up. Yeah, again, looking down from the front, or from the top, this is left head rotation, right head rotation. There's a lot of movement in there. And one of the things we found with people with connective tissue like this is that you don't have the proprioceptive or the nociceptive feedback, so you're able to do these very far ranges of motion without pain, and it's not good for you. You end up injuring some of the other structures. The muscles are, well, they're reactive, they're not modulating, they're tight when they're supposed to be tight, they're loose when they don't know whether to be tight or loose, and it's just, nothing's right in there. Left head rotation, we documented how you slide over with left head rotation. There's right head rotation, so you just kind of fall off your axis with right head rotation. Let's see here. There's your left and right, putting them together. Big difference. All right, so there you are. These are the x-rays showing we did adjust you from the right, but primarily from the right. And so on x-ray you can't really tell it very well. I ended up going with there's a dominant vertebral artery going through this foramen, so it's much larger. On this side, the vertebral artery is much smaller, so the vertebral foramen is smaller on that side. And I ended up putting a dot in the center of it, and actually it ended up being a pretty good accurate representation of what's going on. We did show you a little bit how this atlas is kind of elongated on one side, it's calcified there. So somebody might use that as a metric and think that you're anterior on the left. So that would be misleading. You have a great cervical curve. You had lost your curve and you've brought that back pretty quickly. And we want you to stop doing the curve correction because you're already there. I don't want you to go too far. And we do like the idea that the atlas is away from the jugular. We just got your soft tissues are kind of pulling on you. Okay, so an Eagle syndrome is when the stylohyoid ligament gets calcified and it's a tusk and it's attached and it causes certain symptoms. But you can have a ligament that's kind of functioning like an Eagle syndrome with some of these hypermobilities. So it's not really an Eagle syndrome. I don't even like that term anymore because it's just so limiting and it doesn't describe the whole spectrum of compromises that occur here mechanically. It's just a mechanical thing. So yes, some of the soft tissues in the front, or some of the ligamentous structures are going to be pulled on a little bit tighter because of your elastic skin, elastic everywhere. But it's okay now that you're aware of it. You can manage this better. You're going to stop injuring yourself. This is after we adjusted you. This angle, lower angle, got less. It seemed like we moved a degree from here, actually a degree from here to here, but you're feeling better. And this is when you're lying down or upright, you still have the same curve in your neck. That's kind of interesting. Yeah, so this was just to demonstrate that the MRI slices or the CT slices, how far they get us, they have gotten us better than the X-ray with this, but really the 3D rendering is a whole nother dimension. So there's a lot of things that you wanted to talk about. Whatever you want to talk about, I'll answer any questions you got.
I mean, you hit it all. I think it's been absolutely incredible getting to meet you and reading through, watching these videos. They've helped me tremendously and brought me to you, and can't thank you enough for what you do to help everybody, and including myself, on the track to recovery and getting our life back.
Thank you for making this video for other people, because I think it's going to help somebody too.
It's absolutely.
And thank you for your service.
Thank you, doctor.